Cavy Central Guinea Pig Rescue. So she's had a dental, is that right?
Yeah, like back on the 23rd of last month. But we don't know if it's her jaw.
So is she eating at all herself?
No. The first time where she got interested last is like, I've been, like, what we've been doing is, like, I cut up minuscule little amounts of, like, carrot, cucumber, capsicum, and with a syringe, I put the tiniest little bit on the end, but if I cut it too big, she'll go in her mouth and she opens up her mouth really wide and is pouring, trying to get into it. She actually can spit it out. That's what we've been feeding her every 2 hours, is that.
The purchase one. Have you tried making it yourself?
No, not yet, because we've actually been away. So we've actually just got back yesterday afternoon.
All right, so who's been looking after her?
Oh, no, we have. We took
her so she came with you?
Yeah. But we're just sort of at a loss now. We're trying to do everything we can for her. We don't know what we're missing.
Definitely her teeth. Her teeth are really hooked at the front. The top ones, they're hooked in, they're not even connecting with the bottom.
He did say that they were slightly misaligned.
Slightly, they're like way out.
Okay.
They're hugely out. Hugely. So she's had dental surgery.
Yeah, where they filed back the spare and trimmed her front.
You can actually see where she's even trying to grate into the top one. She can't. She can't do it.
Yeah.
Her front teeth, come around and have a look. And what you'll see is that the top two incisors actually go down and curl in under, and her bottom teeth are sort of trying to cut into the top ones because they don't align at all.
Yeah, no.
See? But look how she's even trying to cut into them. There's like a groove in them. So she can't even grind.
No, well, so is that front one meant to go over or under?
It's not even connected. So they should be behind.
Oh.
That's she's tried to chew on the cage and pull the front one over the bottom one.
That's completely malaligned there, so that like her teeth are completely.
So that's why she can't pick anything up.
Yeah, she can't pick. Like there's no way she could pick anything up.
Yeah.
Because she can't get it from the bottom under. So Bubbles has just lost his buddy, yeah?
Yeah.
And you're wondering what to do.
And I know all the details, so just let her know.
And we don't know what happened to Bubbles, no?
Too funny.
Bubbles is really good. He's a pretty vocal piggy.
He is.
Yeah, I can tell that he's pretty good with his vocal cords. The only thing I noticed was, listen to that side just once again. He's almost singing in there when you listen to him. When you listen to his chest, he's very vocal, like you can hear him almost singing on this side and nothing on the other. He's got a bit of discharge from the eye on this side, but nothing on the other. So maybe they had a bit of a virus or a cold, could be something like that, could be something else that's occurred with the other one that just hasn't been picked up. So I'm just going to remove this. This is Mela 7 water, but I'm just going to remove this little bit of debris that's here, so that tomorrow you'll see if there's any more that's occurring. So if we remove that, then we know, he's well and truly over. He's got nothing from his nasal passages, which is good. For people particularly with black nails, it's really hard because you don't want to hurt their feet. Yeah. So this is a way that we deal with them. Yeah. And then you can have a little bit of grass. Want some grass? There you go. Let me just gobble that up.
So like that guinea pigs, they're having fun and they don't say no to foods.
Yeah, that's right. So he can have some food like that and he gets a reward, and he didn't panic, nothing's hurt. And this is how you can see he's quite happy just sitting munching, he's fine. But that's how to do it, is to towel wrap him and then to create a V shape, head in this position so his spine is supported. And then we can do that sort of thing with him. Yeah, and just trim his nails carefully for him. So we've done his ears, we've done everything there. He hasn't got any sign of mites or anything, so you're looking after him really, really well. I would say that whatever has happened to the other boy is unfortunate. If you follow along with us, come up if you're concerned about anything with him, and then we can check him out. And you're gorgeous. So, yeah, we'll see you again soon. This is Rosie. And they're about 6 years old, is that right?
They are only about 3 years.
Oh, 3 years old. Okay. That's all right. So have you got any concerns with them at all? Or just for a check?
Just for a check. She's been a little bit lazy, I suppose.
Yeah.
Sleeping around a bit.
Yep.
I don't know if that's normal or...
Okay. Oh, what are they doing? Something major going on here. She does have a big problem here. Big problem. She does have a tumorous lump here. Alright, so this little girl's got some fungal. We'll start at the top. She's got some fungal, and we can tell that because here, just on feeling it, I can feel it right round her ears. So we get rid of that with Malice-7 water. And she's had a haircut back. Where do they live? Are they inside at night, or are they on the lawn? What do they do? They're outside the whole time? Outside cage or the whole time? Like a hutch?
Yes.
Gotcha. Okay. Alright. She's got a pretty serious issue down below. This is the thing I'm really concerned about down here. You can see how red it is here. This is a lump which has formed. Now that would be causing her considerable discomfort. I'm just feeling if it's... We often get bladder stones down there, but sometimes they get caught and they can present in a different way. This is soft tissue. So it's, yeah, sorry about that. Just so that if she urinates I can see what she's doing. It's in the worst position for her. Have you noticed this before? No?
No, I haven't.
Okay, yeah.
I know one of them is doing some strange urination.
Yeah.
Orangey.
It's this one. She's bleeding. Yeah. It will be this one for sure. She's not in pain touching it, but she's definitely got... Yeah, she's got a serious problem there. Alright, let's just do it. The simple things first. Let's get this down. If you come and feel these ears, feel that ear there, you can feel how rough it is, and then just as a feel, you'll know how it is. I'll clean this one up and then you can feel the difference in them. Particularly around the edge, like when you move your thumb off like that, if you move it off that way, you'll see what I mean. It's like a ridge. Feel that? Like an edging to it. Okay, so when I do this ear, you can then feel the difference. This isn't going to make that little lump any better, but it's going to get on top of some of the stuff that's going on with her. So, feel this now, feel that, and you can hit that. You can use both hands to feel that. Totally different? Okay, so this is how you need to keep it. Do you want to come and feel them? No? This is how you need to keep them. Did they put her on antibiotics or anything like that?
They put the other one on antibiotics.
Yep.
I think they gave Rosie a thing as well, a needle as well.
Oh, for mites?
No, it was for
Antibiotic injection?
It was for worming thing they gave her.
Yeah, it's ivermectin. They've given because ivermectin's the only injection they give for that. It's for parasites. Okay, well this one here, what I would recommend, the injection that they've given you is an ivermectin injection, and they use that for worming for parasites on guinea pigs. You can treat with ivermectin topically yourself, and you put it on here behind their ears onto this naked sort of skin. So we'll pop some on them here, but you ideally need to do that again in 7 days, and then just repeat that in 2 months' time. It would be very sore for her because it's like a massive swelling in around here. You can see how red it is. It's this area here. This is all a lump. There's nothing on this side. That's how it should be. but she's got this in this area. This isn't a bladder stone. There's a couple of things it can be. One is an abscess, which I would hope it is, in which case it'll continue growing and it will rupture. So, and when that does, just come back up here and I'll flush it for you and clean it. That's fine. The other is if it's a tumour, then it's really not going to be good for her, because in that location it's disrupting a lot of things. So she might be the one that's doing the bleeding when she's urinating. Did you notice fresh blood in the cage with urinating? Is that what's
That's what, yeah.
orangey colour? Okay, so I suspect at this stage it's this one. Let's have a look at the other girl. Yeah, Gumnot's lost a lot of weight.
And I think that's from that time when she went, 4 weeks ago.
Okay. And she's continuing to lose weight.
She is. She's
Yeah.
eating.
Okay.
Like she's
Are you
not-
weighing her? No. Okay. All right. I need to start weighing her. Put her in an ice cream container and put her on the kitchen scales. So you weigh each week, so you know what's actually going on with her. And I know, Bubba. Sorry. Let me see you down here for a minute. So no lump with you. She was way bigger.
She was the one with that issue.
Yeah, that's just fungal. It's actually not so bad. The weight loss on this girl is really interesting. And what's really fascinating is this. Can you see my hand is closing on her completely here? There's nothing there. But on this side there is. But this side there's nothing. And ovarian cysts rupture. I'm actually wondering, has she had one rupture? She'd be a very sick little girl if that happened. She's got fungal up through here, same thing. You can see that through here. And we'll give them both a wash. We'll just get their ears done. Okay. Just see. So she's not clean blood, it's the other one.
I thought it was.
No, it's the other one. It's the lump in the urinary tract down there with her. So no, it's the other one. Yeah, what the vet has given is an ivermectin injection. It's mites that they've had, and mites and fungal go hand in hand. This is fungal. We'll clean all of this off for you, so it's a whole lot better still. But and it would be way less since he's given the injection with ivermectin. This is sort of, it's actually due in part to the housing that they've got, and you can rectify that really easily. So I'll have to show you how to do that, and we'll probably do it online after, but it means going to Bunnings and getting some corflute and getting some snake wire, okay? And once you've got those two things, I can show you what to do to change everything for them. So mites and fungal go hand in hand. Mites love damp enclosures, and when you put just hay into one of those cages, it can look like it's got a lot in there, but when they move their feet around, they're standing on the plastic base of the plastic base of the cage, and the moisture is on their feet and limbs, and they can from there transfer fungal spores. So they need to be on a clean, dry substrate, which is done by just changing the cage over, adding some shavings in there. And we can make that a whole lot better. I have to move it to the We've bathed and washed these little girls, and this little one here, this area down below needs to be investigated because it's very large. It's not a stone. It feels very much like it could be an abscess or tumour in this area, but without a doubt it's affecting her ability to urinate properly down there. So we need to get onto that, ASAP with her. You can tuck them both in the carrier together with the towel that you've got. Okay, should we have a look at the other girl? So this little girl here, we've sorted here. You can see now all that dry skin has gone. So that's completely gone. She'll be feeling a lot better. That's fine. She's pooping normally, which is great. Hey, no, it would have been very sore, little girl. I suspect, for her to have lost the weight, she would have been like that for a while. So Yeah. She's looking good. Her hair and everything is looking good. So just keep doing what we're doing, except change the cage. Okay? Alrighty. Okay. Here we go. Tell me about Cookie.
So we got her when she was like only like 6 to 8 weeks
Isn't she
old.
cute? Yeah.
And then she's around 6 years old already.
Okay.
So we brought her to the vet on Friday because
Okay.
Ella just noticed like a patch of hair fell off on her bum.
Okay.
And then yesterday, like when we have a look, there was a lot.
See, that's just a bit of fungally skin attached around one of her hairs down there. But that's all right. Yeah, well, her coat is beautiful, and I really wouldn't suspect mites with this. She does have some fungal, and they put Revolution on her.
Yeah.
So that's good. So that will just automatically, within 24 hours, will remove any parasites. She doesn't have lice or anything like that. And in terms of what we look for with mites, they are microscopic, but there's other telltale trails that they leave behind. So she looks really good. You've applied the Revolution, which, you know, you noticed a bit of skin coming off her hair. You've done the right thing. So beautiful. Let's just check her out. She's drooling her food a little bit because she's dribbling under her chin. So there's hair indicating that. Lymph system's good. Here, little girl. This is maybe that's where one amount of stuff came off. I see this one here, so it'll load more on it. You can see it dropping off there.
Yeah.
That's just, it's in around there. It's just a bit of a wash of I can clean it off. And it drops off like that.
Yep.
Okay.
So that's okay. But yeah, you've done exactly the right thing, so that's good. Mites, when they're tested at a vet, typically come back as a negative. Yeah, but they look really good. And we're just going to check her teeth because she does have some drooling actually going on. Let's see. Oh, great teeth there. She's got some food caught in them. I'll take them out for you.
Okay. Yep.
Ones you can see right up close. Yeah, she hasn't got too much. She's just got a bit of food.
Oh, good. I'll get them up that to running.
Yeah.
Okay. Yep.
She's got a couple of marks on her too. If you have a look at the front of it, I'll turn her around so you can see, but her top tooth has got like a little fracture line to it. So if you have a look up close, you'll see on her top tooth, halfway down on the line on this side, can you see the line?
Yes.
Yeah, it's like a little fracture, but they're constantly growing their teeth.
Yeah.
So in that sense, you know, we don't need to worry about it. Just make sure she stays with her food. At some point it might sort of break.
Yeah.
And make sure she's got, you know, good vitamin C food and diet. She looks healthy, so that's good. Just a little bit of discharge in around her eyes. Sort of little crustiness that's there. It's nothing I would worry about.
Yeah.
And it could just be from when they actually clean their eyes, they can end up with a milky substance, but there's little tiny fragments of stuff around there. So we'll just move that off. So that she's back to ground zero. And you'll notice any changes if, you know, if something comes back.
Yeah. And is that normal that they have like a discharge in the eye?
Creamy colour discharge?
It's like white.
Yeah, it is.
Okay.
Yeah, that's completely normal. And that tends to be when they've done that, a little bit sticks in the lashes, and that's what I think this is, because we see more when there's a respiratory condition than if she hasn't got it.
Yeah.
So that's good. But yeah, she looks great. Yeah, just down here. And going across the ear like this.
Yep.
Allows you to sort of slough it off. You can see it's coming off now.
Yeah.
Suddenly you discover, oh, it's actually pinky from today.
Yes. And how often do we like clean that? Is that gonna be like a monthly thing?
When you do their nails, do their ears.
Okay.
Yeah, that's all. I was like, okay, feel those ears now. You feel them. You feel they're a bit different. Oh, yeah. Okay, now feel your other piggy's ears. Feel her ears.
Yeah.
Bit of a difference?
Yeah.
Okay, so that's how you need to keep them.
Yeah. Yeah.
And you can work a little bit more on that one, but it's it's pretty much good and done, which is great. Hey, what's her name?
That's Stacy.
Stacy, hello. Aren't you cute? I think we've done the revolution on perfect timing, really.
Oh, okay.
Yeah, because there's lots of loose hair coming off in here.
Yeah.
So I'm going to give them a bar,
Yeah.
an antifungal bar. Because they need that. And you can look at her hair around the back and you'll see why.
Oh, awesome. All good.
When were they treated with revolution?
Friday.
And where did she put it on them?
I'm actually not sure where she placed it. If she placed it at the back of the ear.
Because if they place it onto the coat
Yeah.
and not direct onto the skin, then it'll be ineffective, or it
Yeah.
might just do half what it's meant to do.
Yeah.
So keep an eye on that.
Okay.
So it's an antifungal, and it makes it really easy just to move off like I'm doing.
Yeah.
But it also treats it at the same time.
Yeah.
Because fungal loves these ears. It really does.
Yes.
All right, let's have them in and we'll bath them. Who's first? Pick a piggy. This girl's a bit thinner than your other piggy.
Yes.
Yeah, has that been a change of late or?
No, she's always been smaller.
Yeah.
Because I also think because she's very active.
Yep.
That's probably why.
Could
While
be.
this one was just like, I just want to sit down.
Yeah, it can be.
Yeah.
Just keep an eye on that.
Yeah.
Okay, number one.
Good done.
Okay, number two. We're in the same bath water, which is a bit like sisters going in the same water.
Yes.
That's how we look at it as bath time.
Yeah.
Yeah, she literally needs this softening down here. Okay, what I want you to do in that one corner is give her a change of a pad every day.
Okay.
So put a fresh pillow pad underneath where she sits every
Okay.
day, because
Yeah.
she's urinating on it and sitting on it, so she's getting urine
That's
scald, which is what's going on.
Yeah.
Okay. There's something going on. My glasses. I know I want to get my glasses on. It's such a busy day today. So many guinea pigs, so many people. So what's actually happened is that she's had a sebaceous cyst and it's ruptured, and that's what's caused all of this area. Okay, and I'll show it to you.
Yeah.
So when we look at her down here,
Yeah.
this is the bit that I could feel. See right there? That's it there. That's the exit point that it came out. And it's interesting because we've just had a girl with a similar thing that's developing, and if it's if it's not an abscess and empties like this, it will become very large and affect the urination. But that's what's happened. So she had it swell up. Did you notice a lump there at any point? No, because they can come up really, really quick. And it would have been quite sizable, but that's actually where it's come out, is that point there. I'm just going to sort of nudge off the top edge of that.
Yeah.
Like this. This is an antiseptic. Maybe it's stingy in this position. Just cleaned up. So that's what's happened. And when it broke open, it literally went everywhere. She would have gobbled it up. They actually do that. They eat that to clear it. And then you don't notice it. You just notice, her fur's mucky and not sort of what's happened. But that's what's going on.
Yeah.
So that's the remains of an abscess. And it's interesting because we've, in all the time we get piggies coming in, today we've seen two of these. One that's been forming, and this one that's actually ruptured. And we haven't had any in probably 6 months to a year. So two all at once. So one that's actually ruptured, and that's what's caused the gunk. That's all washed off and clean now. Her hair will regrow. You've revolutioned her, which is great. That's just a great preventative. What caused it was an abscess. Okay. You do get them. Nothing to worry about. That's cleaned and sealed. Nothing to do. Don't need to worry about it. That will stay clean and nice. And that's it.
So how do I prevent that from happening?
You don't. They can get them.
Ah,
And usually
okay.
people notice them. So you'll see, like on our videos, they'll be on a jaw or a neck or a back.
Yes.
And we get lots of different things from sebaceous cysts to abscesses and growths and just knowing what they are. But that is an abscess.
Yeah.
And everything that's there, all that pussy, hard,
Yeah.
residual stuff is exactly what you find once it ruptures and they've dealt with it rather than us.
Okay.
So yeah, so anything like that happens. If you notice a lump or a bump,
Yeah.
just come up here and we can sort it out.
Yeah.
Okay?
Okay.
Yeah, and that's it. So she's cute. So this is Ollie.
Ollie.
Yes.
Hasn't been too bad.
Ollie is about 6.
Yeah, we think so.
Yeah. Has the craziest ear.
Yeah.
Wow. Look at that over here. That is crazy. Okay. It's just scar tissue that bumps it in. Yeah,
It was
can't
like
removed, yeah.
blood filled.
Yeah.
And they drained it twice and then it just turned into that, and so we're like, okay,
Yeah, that's
it's got a
okay.
funky ear, but that's
Yeah,
cool.
he's got a load of fungal in there, so we'll clean all that out. We'll do that for him.
Yeah.
So have you got any particular questions, queries with
Not
him?
really about him, he's all,
Yeah, he's good.
he's pretty good.
So we're just going to treat him for some fungal. He's got loads actually. On his
I
ears.
did treat them with Ivan's Revolution about probably 3 weeks ago now, and then a week after I did that, I malasemped them.
Right. We've still got mites actually. Yeah, he's still sort of got them. We're going to give him a whole bath
Yeah.
all over because he really needs it. Let's put that right. But he's got lots of. If you look in here, I can show you. If you're looking at his coat and at the back, see it's sort of wispy around here, but what you'll notice down here, see all this flaky skin and sort of dropping out there. See it in there, in through here. Like this is, you can see what I'm talking about in there. You've got a good look at it there. So we're going to wash you. We're going to bath.
You love baths, don't you?
Yeah. Yeah, we're going to treat that ear because that's a spongy ears. Part of what's actually going on with his ears is his paws. Because he's older, yeah, and you can see his little curled toes, so it's more tricky for them to get the curves in around their ears when they've got their little old paws. That's just, a feature of being older. We need to help him a bit with that, that's all. He's beautiful. Ollie, we're going to give you a bath. Who is this? This is the one you're worried about?
Yeah, this is Alby.
Alby, we're worried
Alby's
about you.
just turned 7,
Okay.
and he's a grandpa pig.
Yeah, it's the same deal with
Yeah.
his ears. We'll sort all that out, Alby.
His fur's coming off in clumps,
Yeah.
which is sort of the fungal.
recommend having your
His nails are much curlier than Ollie's.
All his ears are worse though. Yeah, these ears that we have to sort out, which we'll do. We'll get done.
And he's starting to need.
He's got more serious mites. Like, it's really,
It's just coming.
Yeah, this is mite. So the mite treatment hasn't been effective. Like he's going to lose a lot of fur. So, okay, we're going to sort this out for you, little dude. Yeah, the Revolution hasn't worked. When you get guinea pigs that are older, they're more vulnerable. Like he's going to have a naked patch in here, just touching him now.
Yeah.
After I bath him, I'm even going to give him some medication just to make that process easier because it's going to bother him. But we'll do that and we'll get this all sorted, little dude. And then he'll need some ivermectin and he'll need a high dosage of it. Like he's going to lose a lot.
Yeah. He's only really started losing the hair like that in the last sort of 48 hours.
Yeah, the problem is when it takes hold, it all goes at once and you think, what?
Yeah.
Like,
It's just,
he's going to be a bit naked
You
through
can do that
the
all day
phase.
and he'll be a skinny pig. But
He's going to lose a lot, and he's almost at the stage. As I touch here, see his head bobbing back. That's like this is bothering me. So we're gonna really have to bath you carefully, little dude. Yeah, all over. Okay, all right. Yeah. Okay. All right. So we've got a big mite issue with all of them. Do they all get housed together?
Yeah.
It's got some impaction.
Yeah.
There, so.
He gets sort of every other day. I give him a hand.
What you doing, little dude?
Oh, I love it. Yeah.
I know. I'm going to bath you up. You're going to be fine. He's got little toe spoons, little digit spoons.
Yeah, he's had them.
He's got them double-sided. That's pretty cool.
He's had them since he was tiny pig.
We often see them just on one side of the paw, but he's got them on both sides. So one here
Yeah,
and one on the other.
side.
Yeah.
Both front feet.
So yeah, we'll take a look at that as well. So we'll sort him out. Okay, who's number 3?
Roo, baby Roo.
Roo, baby Roo. So I'll pop him back.
It's 3.5.
Hello.
It's 3.5.
So where did you get him from?
He came from one of the local vets.
Yeah.
He was found. We've only had him about 10 days.
Okay.
He was found running the streets.
Right.
Someone managed to catch him. I don't know how.
Poor little thing.
And yeah, we had adopted him.
Great. That's excellent. I'm just checking that he hasn't been the one that sort of brought them with him, but 10 days is too soon to
Yeah,
see.
that
Like he's had that for a while.
Yeah.
Okay. So
I'd love to
yeah,
know roughly how old he is.
yeah, I would actually put him at around 5 months.
Okay.
So yeah, definitely 5 months
Yeah.
ish. There's this marker, so I'd pick a birth date. It looks like he's been barbered.
Yeah.
There's a bit of barbering
He's growing
going on.
out since we've had him.
Yeah, and his hair's getting curlier and longer.
I know, it
here,
looks
so,
funny.
Yeah, and he's got, no sign of bite wounds in here, so he may have just escaped, but more than likely he's been dumped.
Yeah.
And so I'm glad he's found a nice home. All right, we're going to get some barking happening.
Settling in well.
There we go. So I've got Alby. Where's Alby? Come on over, Alby. So, do you give Alby baths at all?
Yeah.
Yeah.
He mainly does that.
Yeah, he's going to not like what I'm going to do.
Probably not.
Probably not. That's all right. I know. This is the area that's a problem to him. So I'm just going to move this way. I know. That's okay. It's okay. This is why they need the meds on board, because it's just too... You can't shift what you need to without it. It's alright, puppy. It's alright. It's got mites. It'll be okay. It's not so severe, it's at the point of catching it now. Yeah, he'll feel a lot better. He's a little old boy. We have another little old fellow that comes down. We do the videos on him. Milo and... What's his buddy? It's not Pebbles. The blonde and the chocolate brown boy. Yeah, they're like 6.5, 7 years of age.
Yeah.
Well, his buddy always has severe mites, like every 2 weeks. And he's on ivermectin revolution, but he's just... So his immunity is so depleted that we get him in and treat him all the time. Admittedly, he's due in again next weekend. We've only started the treatment of him like a month ago, but to get on top of it, it's going to take a little while, but we will.
Yeah.
Yeah, and it's a bit similar to this. So when you've sort of massaged it through, you can go this way. He won't like it. Go slow. Go slow. Going slow is the trick, okay? And then this is the piggy that's more severe, so you'll be right with the other one.
Yeah, Ollie will just run at you.
Yeah,
That's just Ollie.
that's alright. He'll be a lot better.
The old man.
That's alright.
He's going to be alright. So we're feeling so much better soon. Little dude, that's alright. He's going to feel so much better though. That's all nice through the mouth. That's good.
It's going to be a skinny pig.